Good morning, everybody. And today my topic is about something which is related to a project that I started 3.5 years ago. When I'm going to explain about exercise medicine, I have to show you some slide, because this slide is the start of this story. First of all, I would like just to separate my presentation in terms of the outline. And the outline is I'm going to talk about the background about why exercise medicine is needed epidemiologically, and the principle of exercise medicine and the stage of development of exercise medicine in Qatar. But this slide is really, I will keep it for my life. This is the gym where I used to go even before I joined Aspetar. And there are 3 sentences here. It will gives you idea about why we should promote exercise medicine. Start from number 6. You shouldn't use the gym if you are suffering from medical condition. And you have to be screened. And the screening does not exist. Okay? And nobody, even when I register in the gym, nobody asks me for a screening. But it's there. I think it's just to remove the legal liability. And person using the gym at their own risk. So I'm not supported. Okay? So it's like represent the avoidance behavior of even those who are running the exercise facility. I will not take the responsibility, but you have to use my gym when you pay. Okay? So this is the principle of the exercises medicine should come to overcome these things. And I think we will remind ourselves about this slide when we implement exercises medicine, because it's one of the I will start with background. I like to start with even representing the magnitude of the problem. And if we see the WHO data, you can find that especially in America and Middle East and North Africa, we have a problem of physical inactivity. And especially in Gulf region, you can see how much is the magnitude of the physical inactivity. Here you can see, even if you compare North Africa with the Gulf states, you will find this is really huge, especially in adult. And if we put a focus on our country, we will see that we have a real problem. It's not about only the female, it's overall a problem. So we can almost have half of our adult, they are not met the requirement of physical activity. And this is the minimum requirement according to the guideline, the 15 minutes per week. I will make even the situation worse if we compare this data with the data which is gathered from the school survey in the same year. And you will see that the children, they are inactive and they don't meet the 60 daily hours of physical activity, which is maybe not only the structured exercise, it's even playing in the ground as a children. So it's like the problem is going to increase if you don't interfere even in early ages. And the course for this that will happen, that those who are in sedentary behavior, they will remain sedentary, almost likely to remain sedentary when they become adult. And all the biological effect to get adulthood disease, chronic disease, is going to be accumulated from early ages. I did this study before I joined Aspetar, but it was even helping me to understand what is the importance of the capacity building and why people, they don't promote exercise. And if the physician, they are not trained in exercise counseling and even the basics about the exercise prescription. And this is really a real situation, because in your medical school, you will not be trained in something called sport and exercise medicine. So you will not even focus on the importance of exercise in promotion. Although there are some subjects in the curriculum, either in the undergraduate or postgraduate, is going to be inserted, which is related to nutrition and smoking cessation. But for exercise, still this is deficient. So somebody asked me how you are going to promote exercise while you are working in a hospital. So this is another challenge that I will put it even in a slide. But Exercise is Medicine initiative, when we review the best practice, it's an initiative that you can even promote it in different level of healthcare. You can promote it in community level, even in hospital level, and even in tertiary centers. It's a matter of giving the people the right training and connect them with the resources. And exercise medicine is not something that related to the American Academy of Sport Medicine. If we review the history, we will find this doctor who's from India. He's the first physician who prescribed the exercise for his patient, and mainly for those who are suffering from overweight and obese. And he said that movement, regular movement on daily basis, it will prevent obesity. This physician from China, and he's a surgeon, and he prescribed, although he's a surgeon, he prescribed exercise for enhancement of the health. And he prescribed it, it's even if you are obese or not obese, you have to do exercise. Okay? So it's not something new to use exercise as a medicine. But Exercise as Medicine initiative, it gives a simple solution for everybody practicing medicine or practicing his specialty as exercise science, or those even who are working in a fitness facility to become a promoter for exercise. Exercise as Medicine is a global initiative, and it's now spreading all over the world. And we have our center here in Qatar, based in Aspetar. We are doing the Exercise as Medicine intervention, as well as we are a trainer for Exercise as Medicine, and I can show even some activity that we have it. Just for those who are not familiar with the concept of exercise medicine, you have 4 goals in exercise medicine, and you have to try to put it in your healthcare system. One of them is the vital sign, physical activity as a part of your vital sign chart. So you ask about the physical activity status in every single visit, and this is the start for the counseling. So you choose the inactive people, and you try to promote exercise. And the most interesting thing, that physical activity vital sign is a good indication for even those who are doing more exercise and they hurt themselves. Another example, those who need to know their activity so you can promote the exercise, because you have to know the interest of the patient or the previous interest of the patient. The second principle is related to how you can prescribe, and a simple prescription that I can understand it, and even my fitness coach, he can understand it, and my patient. So a prescription that very simple, and I can give it to my patient. Putting a framework with allied health and fitness profession, and this is very important, because if you don't have a fitness coach who are trained with the same principle of exercise medicine, you will miss a lot in implementing exercises medicine, because he has to be equipped with some skills, and he understand your role, understand the condition, and you understand the intervention he's going to give it, so you explain it to your patient. And even for the monitoring, because if you put your patient in one facility or 3 facility which is certified with the same standard for exercise, you can evaluate your patient outcome. The 4th thing is related to the public. You have even to educate public and encourage them to ask about physical activity intervention when they visit their physician. So it's a 4-component touching the most important player of the exercises medicine initiative. It's not only implementing the exercise referral scheme and doing the exercise. In exercise medicine, you have to do a lot to promote it at policy level and to train and educate, because you're more spreading the idea with other practitioners. This is the aim of exercise medicine. You shouldn't limit it to your institute. And this is not what we are doing now, especially with the wellness center that the Ministry of Health now doing in certain area in Qatar. So we train the primary care physician and some allied health to operate these facilities. Having a partner is very important thing, and media research is a key area in EIM. Research, because there are a lot of opportunity to promote research through exercises medicine interventions. Now I'm going to just go through our experience in exercises medicine Qatar, and it's not limited to the clinic that we have it. It's limited about how we plan it and how we're implementing it and what are the things and the tips that I would like to share it with you. First of all, when we put the plan in 2013, it was really far away from what we achieved in this facility, because it should be a network of centers with a reference center of Aspetar. So we are dealing with the people with risk factors, and this is our understanding at this moment. But then we discover that there are some group of people, they can get benefit from aerobic exercises medicine. It's not only the inactive people. And we built our plan with sharing the multidisciplinary approach. When we met with several departments, and we put the clinic with a multidisciplinary team. So we put this multidisciplinary approach in exercises medicine, and we develop it by having the medical team, the exercise physiology, and physical coach and nutrition all surround the patient. I will not forget the role of the nursing, because they are very important, especially in taking the vital sign, which is very important in our recording, and even to stress on the patient to go to all the practitioner giving the care for the patient. So the first lesson we have it is the multidisciplinary team in one site, and this is what even our experts, when they come here, they said that the good opportunity for you that you have a multidisciplinary team in one site. Even the fitness coach who's trained is under Aspetar or our partner Aspire Active. So we are communicating with them on the same page. Capacity building, this is the challenge. Actually, I can describe it as a 1 year of a challenge in 2014. And to find out who's going to train you in exercise medicine and who's going to train your team. And the training is provided by the exercise medicine curriculum in Singapore, I remember in this year. And we train 2 categories of people, the allied health and the medical team. We develop in the same time the partnership with our fitness facility, with Aspire Active. And if I'm talking about the fitness facility that we have a partnership with, we have to put in consideration the first slide I show it to you, that I couldn't take the people with high risk. But we solve this through the capacity building when we realize that we should involve them even in the planning and the training, so they can understand that it's a process that will filter the patient, so you will deal with the low risk and sometimes with the moderate risk. High risk will be eliminated from the screening because they need to be referred to a specialist or to be referred to get a clearance. This slide is very important because when we sit with them, we recognize that they are afraid from the risk. So what is the solution? The solution is to have this training. And this lady, she trained us in a cardiac rehab for a certain extent, which is very extreme, exercise therapy for rehabilitation of people after they get their MI. So she has a project with the Imperial College, and she trained a lot of fitness trainer, and she's doing in 3 category, 3 training for those who are beginner, for those intermediate and advanced cases. So we brought her, and she started to train our trainer in Aspire Active, just to break the fairness from having some cases. And the stratification that we provided is very important for building confidence to deal with the patient. And this type is, I think I share it with you as a lesson. So extensive training for your fitness coaches, especially with some cardiovascular cases, although they will not deal with it, but it will build a lot of confidence that what I will see as a risk factor for cardiovascular is quite lower than what I trained on. We developed the physical activity guideline in the same year, and I heard a lot that the guideline is already there. Why you develop a national one? And the importance of the national one is just to make the social adaptation for it. So you will have education for the people in your community with the exercise that they can do it, and they are suitable for their culture, for their environment. So the importance of this guideline is to target the community, to target even the practitioner. When we target the practitioner, we will get this. The guideline will help us to unify our messages. So I will speak in the same language as I will prescribe it, as the patient will find it in our educational resources. In 2015, we start to do the implementation and the clinical operation for our clinic. And in this year, we designed the pathway, we designed the screening process, and we designed the exercise program and how to monitor the outcome. And most of the people, they are trained in the basics of exercise medicine, how to design the exercise intervention, but you have to organize it and you have to unify it between the practitioners so they recognize the unified pathway between me and my partner as exercise physiologist, my partner as a fitness coach, so they understand what the whole process for your patient. So in this pathway, we start from the basic things which is related to the diagnosis, referral of the patient, and then doing the counseling. And here we classify the risk of the patient, and then those who are with moderate and lower risk, they will go to the exercise program, which has time for review, the 3-month, 6-month, and the 12-month, to monitor the outcome of the exercise. Here in the pathway, you have to develop even a role for each partner. So you will do the counseling and the screening as a physician with a simple prescription for exercise. Then your exercise physiologist will design the exercise, either the group exercise or the gym-based exercise or even the home exercise. And then your certified fitness coach will supervise your classes. If the patient prefer to go with a group exercise, which is under our supervision, they will go under our certified fitness coach. In the screening process, It's not a matter only about screening the patient about their medical condition. Even you have to screen them for their previous injuries, because some people, they were active and they get injured, then they relapse to the inactive status. So when you take the history of your patient, you have to take the history of the previous injuries and the previous even exercise history. And this is very important for us, because we learn that it's not only taking the physical activity vital sign, you have to ask about the previous history of physical activity to know the interest of your patient. And even sometimes you know that this type of sport is related to the injury he got. And even you have to know about even the gym equipment that they have it at home, because some of them, they get injured from using these equipment incorrectly. So you can just advise your exercise physiologist to explain to them how to use it. Developing the forms and developing the easy program is one of the most important things. And actually, when we develop the forms, we develop it according to the pathway. And we develop even the translation. We are using a software, the type of exercise that you have to do it, as for example, strength or aerobic exercise. So the patient, he can do it, like for example here in the gym, if he prefer to have a gym-based program. And this is one of the most important thing that we design it for ourselves, and it will help us even in the electronic medical record for designing your form systematically with your pathway. So you design the area which is related to the counseling, screening, or prescription stage. For exercise physiology clinic, actually, it's a really important service that we provide. I have to acknowledge that having them within the same place, develop the assessment for the patient, designing the program for the patient, answering the questions of the patient about what is the right thing, what you should avoid, is very important. Because I think I value their contribution with this, and it will delegate some of your responsibility as a physician to your colleague. So your colleague, he can do a lot with plenty of time to answer the question of the patient. For the designing the supervised program, we adopt the circuit type. And actually, it helps us to accommodate larger group of people. And the most important thing, that you can monitor them and you can alternate the exercise with the exercise instructor. So what are the cases that we have it in EIM Qatar? Actually, we start with osteoarthritis. And we have the agreement that to refer people with even early stage of osteoarthritis, just to make like a prevention program for them to stop the progression of this condition. We have even some people who are having the plantar fasciitis, some people with patellofemoral pain syndrome. So these are the major category of patient that we have it. Some people in this category or in this category, I can categorize them in this way. Some people, they are inactive, so they get the osteoarthritis. Some people, they become highly active in a wrong way, or they are doing certain type of exercise that will develop certain condition like patellofemoral or plantar fasciitis. Some people, and this is in the history about the retired athlete, and those who are already retired and they become inactive, and then they develop this medical condition. So EIM could focus on certain condition like a retired athlete who stopped exercising for a long time, and active patient who need modify their exercise. It's not only restricted for those people who are inactive. For monitoring outcome, actually, we measure a certain area in outcome. We start with the compliance. So this is very important for us because the compliance, it will gives you idea about the people who are starting to change their behavior. BIM, hemoglobin A1C, and lipid profile, blood pressure, and we start to include some questionnaires which is related to the knee injury and osteoarthritis outcome score, which is cause, and we start to even put the psychometric scales just to evaluate the psychological effect of exercise, because this one we forget it sometimes. We focus only on the physical domains and we forget about the psychological effect of the exercise. So when you measure the outcome, regardless what is the condition that you have it, which is a physical condition, it's recommended to measure the multiple outcome, and this including the physiological, functional, and psychological outcome of your patient, and this will build a lot of data so you can get the outcome that have it as a short-term improvement or long-term improvement on your medical condition. So here is some statistic and the growth of our patient in the clinic, and we can see the variance, especially in certain area. Like for example, during Ramadan, you will face some drop, which is a normal for health services, and even during the vacations. So for the exercise therapy classes, although we have limited classes, which is only about 2 classes here and 2 classes in Aspire Active for ladies, we have a good compliance. So those who are completing the 1 month in 100% compliance, we have a growth, especially in ladies. For exercises medicine training is very important to disseminate our idea at the national level. As I said, that we have the first now wellness center, which is recently open, and we are training some of the primary care physicians who are providing the service in this center in exercises medicine, and we have a local team here in Aspetar. Some of the sport physicians as well as some cardiologists, they are developing these courses, and we build a lot of number of people who are a physician or allied health to be trained in exercises medicine. And what is interesting, that the first gym that I just show it in the first slide, when they put that they are not taking the medical condition, they are now operating the wellness center. So in summary, I think for exercises medicine, you will be even more powerful if you have a multidisciplinary team. You can provide they can provide you a lot of skills that you don't have it, but they can have it according to their specialty. Training of fitness coach is very important because they become confident and they will deal with the patient on a regular basis more than the clinician. So it's very important to build the skills on those profession to help the patient to get active. Measuring multiple outcomes is very important, and to get the previous physical activity history is very important. It's not a matter only of the physical activity sign, and the most important thing is the AIM could focus in certain group of people who are becoming now inactive, but basically they were active. Thank you very much.